Hello friends, I hope you all are fine. Please like and subscribe the channel. So today's topic is copper T insertion, and before going to the topic, I just start the topic with the few lines, that is, the planned pregnancy can be hard enough on a person. By covering the full cost of an IUD, be helping to prevent a difficult situation from recurring. So the copper T is an intrauterine device made of plastic and copper. It is used for contraception and family planning. It is highly effective reversible family planning method. Revision: the copper bearing intrauterine contraceptive device is a small flexible plastic frame containing copper which a specially trained provider insert into woman's uterus. Another definition: copper T specially designed device into the uterine cavity of a fertile woman who desired to prevent conception, pregnancy for a specific period of time. Purpose: to avoid unwanted pregnancy, to space pregnancies. Type of IUD: there are two types of IUD, that is hormonal based IUDs and copper. Hormonal based IUD are in forms of Mirena, Kylena, Jadus, and copper T IUD, that is Paragard. Type of copper IUDs available under the national program: copper T 200 is effective up to 10 years, and multi-load 250 effective up to 3 to 5 years, and copper IUCDs 380A which is effective up to 10 years, and copper IUCDs 375 which is effective up to 5 years. Mechanism: copper T act primarily by preventing fertilization. Copper ions decrease sperm motility and function by altering the uterine and tubal fluid environment, thus preventing sperm from reaching the fallopian tubes and fertilizing the egg. The device also stimulates foreign body reaction in the endometrium that release macrophages and prevent implantation. Hormonal IUCDs primary mechanism of action is to prevent fertilization. The novonorgestrel intrauterine system has several contraceptive effects, although thickening of the cervical mucus appears to be primarily effect. So, the ideal candidate for IUD use: having at least one child, no history of PID, which means pelvic inflammatory disease, ectopic pregnancy, normal menstrual cycle, access to follow up and treatment in monogamous relationship, willing to check IU detail. Indication: multiparous and nulliparous women at low risk for sexually transmitted disease, women who desire long-term reversible contraception, women with medical condition, hypertension or other form of heart disease, liver disease, diabetes, breastfeeding. Contraindication: absolute, suspected pregnancy, vaginal bleeding of undiagnosed etiology, significantly distorted uterine anatomy, pelvic pregnancy, relative breast carcinoma, immunodeficiency disorders. Advantages: every effective is very effective, safe, convenient to use, used successfully in lactating women, can be used over long interval of time, immediately reversible and ideal for spacing, affordable. Copper T 380A is supplied free of cost by Government of India, highest continuation rate. Then advantage: menstrual irregularities, dysmenorrhea, pain during menstrual cycle, trained personnel needed to insert and follow up IUD, Insertion is painful, does not prevent against sexually transmitted disease, increase incidence of pelvic inflammatory disease. Woman cannot stop IUCD use on her own. There is slight risk for ectopic pregnancy, risk of expulsion. Next, of insertion, interval insertion, insertion during lactational period,